So you've come to me with your heel pain and arch pain, had an evaluation, and had your foot taped. Now you go home and you would like to reproduce that taping, and today I'll show you exactly how to do that. First, let's just talk about what you're trying to achieve with the tape. Here's the skeletal model, and as I collapse the arch, you can see this side of the foot getting longer. That's what pulls on your heel and creates the pain. So the goal of the taping is to not let that side of the foot collapse when you step down. Over here, we can see the foot, and if I push on it as if the ground were hitting it, it would collapse the arch. Once again, if we have the foot relaxed and tape it in this position, then when you step down, you'll pull on the tape and other materials before you pull on your plantar fascia. Taping starts with binding of the foot. 1-inch tape is typically what we use, and this is adhesive tape. And athletic supply stores where you can purchase various widths of tape. A thin piece of flat mesh tape will be attached to the heel, the ball, and then when I push the middle in, you'll see the front come down in that relaxed position I was talking about. To prove the point about this being pulled on before your plantar fascia, notice when I push on the foot as if I were landing on the ground, you can see it separating. That is, the body's trying to pull on that before it can pull on your plantar fascia. All the other steps that we take, this is a piece of moleskin, it's just another tougher layer to reinforce the first layer. Applied to the heel, applied to the ball, and then push the middle in. The 1-inch tape is then applied starting from the outside of the foot, or as we call it, the lateral side, at the base of the baby toe, or fifth toe. And then it's pulled around with the foot in the relaxed position over here to the inside or medial side of the foot, reinforcing that relaxed arch position that we started with in the first place. Taping gains its strength when you apply the larger 1.5 to 2-inch straps from, again, the lateral side first, and then you see me pulling to the medial side. Each piece of tape overlaps the next piece by about 1/3, and the overlapping again increases the strength, as well as the fact that the first straps ran up and down the foot and the other straps come across, creating the effect of basket weaving and strengthening the taping. We then apply one more long strap around the base of the heel, starting the base of the baby toe and extending around the medial side of the arch. And lastly, these two pieces, which purposely are put on only to hold the sides of the tape in. The first piece is put on the top of the foot, and we don't like to put adhesive there because it will tend to cut into the patient. And so when you put this on, you'll see this part purposely will not stick to the top. And this one is not cranked tight, and instead the foot is brought up a little bit and then attached. So you can see it's actually loose. When you step down on your foot, you can see then the tape comes close, but it won't cut into you. Now when foot is put on the ground, it should pull on the tape before it pulls on your heel. A low-dye taping can be left on your foot for a few days. Clearly you'll need to keep it dry by using a plastic bag and taping. The benefit will primarily be gained during the first few days of taping. When you return to the office, we would then determine the best course of treatment following the test of the Lodi taping.